Ever heard of cervical spondylosis? If you haven't, you may want to listen closely. Cervical spondylosis is a common age-related condition that affects the joints and discs in your neck. It's also known as cervical osteoarthritis, or quite simply, neck arthritis. Now, this might sound like just another health term to add to your vocabulary, but it's more than that. Cervical spondylosis can be a serious health concern if not treated properly. Imagine having constant pain in your neck, or worse, experiencing difficulty in moving it. Not a pleasant thought, is it? But don't worry. While cervical spondylosis is common, especially as we age, it's not an inevitable part of getting older. With the right knowledge and care, you can manage or even prevent this condition. Intrigued yet? Let's delve deeper into this condition. So, how do you know if you have cervical spondylosis? Well, the symptoms of cervical spondylosis can vary greatly from person to person. For some, it might start as a mild stiffness in the neck that gradually worsens over time. This can be accompanied by a persistent ache or discomfort, especially after long periods of inactivity, like sitting at your desk or sleeping. But this condition doesn't always confine itself to the neck. It may also cause headaches, typically starting at the back of the head and working their way forward. This comes from the pressure and strain on the nerves and muscles of the neck. In some cases, cervical spondylosis may even affect your balance. It can cause a sensation of spinning or a feeling of unsteadiness on your feet. This can be quite alarming, but it's a common symptom and usually improves with treatment. Yet, it's important to remember that not everyone with cervical spondylosis experiences these symptoms. Some people may not have any noticeable symptoms at all, while others may experience severe disabling pain. The severity and frequency of these symptoms can also fluctuate. They may come and go, sometimes staying away for weeks or months at a time before returning. It's also worth noting that these symptoms aren't exclusive to cervical spondylosis. They could be caused by other conditions as well. Therefore, if you're experiencing any of these symptoms, it's important to consult a healthcare professional. Recognizing these symptoms can be the first step towards getting the right treatment. You might be wondering, what causes cervical spondylosis and how can I prevent it? Well, let's dive right in. Age is the biggest risk factor for cervical spondylosis. It's a bit like wear and tear on a car. The more miles you've driven, the more likely you are to have some breakdowns. However, age isn't the only player in this game. Other factors can also contribute. For instance, if there's a history of the condition in your family, your chances may be higher. Lifestyle choices can also play a role. Smoking, for example, is known to put stress on connective tissues, which can lead to spondylosis. Being overweight or having a sedentary lifestyle can also put extra pressure on the spine, increasing the risk. So, how can we prevent it? First off, maintaining a good posture is crucial. This helps keep your spine healthy and reduces unnecessary strain. Regular exercise, particularly activities that strengthen your neck and back muscles, can also be beneficial. If you're a smoker, quitting is a good idea, not just for your spine, but for your overall health. It's also worth noting that while we can't completely eliminate the risk, these strategies can help reduce it. Remember, prevention is always better than cure. So, you've identified the symptoms. What's next? Treatment, of course. When it comes to treating cervical spondylosis, the approach is usually multifaceted, and it's crucial to remember that each person's journey might differ slightly based on their specific symptoms and overall health. Physical therapy is often the first line of defense. This may include exercises to strengthen and stretch your neck and shoulder muscles, improving flexibility and relieving pain. It's like training your body to better support the weight of your head. Medication is another common route. Over-the-counter non-steroidal anti-inflammatory drugs, or NSAIDs, can help manage pain and inflammation. In some cases, doctors may prescribe stronger painkillers or muscle relaxants. In the most severe cases, when non-invasive treatments aren't enough, surgery may be recommended. But remember, this is usually a last resort and is typically reserved for those experiencing significant neurological symptoms, such as weakness or numbness, or those who haven't found relief through other treatments. But let's not forget the importance of seeking professional medical advice. A healthcare professional can provide a proper diagnosis and create a personalized treatment plan that's best suited to your needs. Cervical spondylosis might sound daunting, but with the right knowledge and treatment, it can be managed effectively. Let's quickly recap what we've learned today. Cervical spondylosis is a common age-related condition affecting neck joints. Symptoms include neck pain and stiffness. Prevention involves regular exercise and good posture. Treatment options include medication, physical therapy, and in severe cases, surgery. Remember, knowledge is power, and understanding cervical spondylosis can help you take the right steps towards a healthier future.